Good everyone. I hope you guys have an amazing day. So what I'm going to do today, I will talk about briefly about the health cloud for providers, right? So I'm going to walk you guys through using Trailhead because just mostly theory I'm going to talk about. So what is a provider in terms of a healthcare term in terms of health cloud, right? So a provider could be your GP, that's a general practitioner or your doctor, or could be someone who provides you a healthcare facility. Maybe even the hospitals you can consider as a provider, right? So you go to, say for instance, if you wanted to do a routine checkup, you go to a GP clinic, or you go to hospital, or you go to whichever center, licensed center, who can uh, offer you the full body checkup, right? So now imagine, and right, so you go to one place. I think we briefly discussed this as well, right? When I mentioned uh, why it's important to have data at one place, so that people who are involved in the care can look at your the report and can give you proper advice or proper healthcare plan, right? So that you get what you're supposed to get, right? That is the right treatment. Okay, the so this is just an example, right? They talked about, from a trailhead perspective, talked about a guy who teaches tennis. He decides to do a full body checkup, so I went to a specific healthcare place where the first of all the patient onboarding is done, and there's the usual stuff, right? Let me give you a very simple scenario. Like, let's say you wanted to um, contact your GP, right? What's the first thing you do? You in today's time, I'm talking not like 1980s, but at least in 2023, you make an appointment, right? Or you email them. So usually the phone appointment is the most common, or sometimes you just, if you happen to around in the neighborhood, you just go and book appointment by visiting the medical facility. But usually you call them, right? And the receptionist who or often answers your call will, book a appointment for you with your respective doctor, right? So that's the beginning of a process, right? Now, obviously, when you call your GP, right, or when you call your the medical clinic, they need to have information about you. So they might ask, can you give us your date of birth and your last name? So based on that, they can search the information and and can schedule an appointment with the right GP. So it's very important to have all this data at one place, right? Or I would say a centralized data where people can see. Obviously, the receptionist may not be able to see a lot of information, but at least they can see the patient name and the doctor associated with that person, and the appointment schedule for the doctor, so that uh, they can book you with the doctor. So that kind of thing is okay. I mean, the data which a receptionist can view, right? And then once they book an appointment for you, you often visit, based on the appointment day, see a GP, and GP will look at your previous medical history and probably, like I gave an example, right? This guy wanted to do a full body checkup, so probably look at your previous history of full body checkup, and they, based on that, they will uh, prefer to give you similar kind of checkup, or maybe an extra stuff, right? And then once you get the report, you've been called again, and then your specialist or someone will go through the data again. So all this data needs to be centralized. So if you don't have it, it's not going to be a very user-friendly experience for a patient, right? So that's the reason why Health Cloud is important. Health Cloud is built to provide a patient care in a very efficient way. So Health Cloud is very beneficial for the provider. Obviously, like I said, uh, the software, any software for that matter, if you want to choose for the patient management, then you need to have a facility for uh, appointment scheduling, facility for SMS, um, you know, and the portal for the customer, right? Obviously, you as a customer would like to see your information. Like for instance, in New Zealand, we have something called NHI number, right? You punch in your, so that NHI number is like your unique ID associated with every person, right? That NHI will be tied to your medical records. So that's how it works in New Zealand, at least. I'm not sure about United States. I don't know how it works. I mean, you guys have social security number, but does it really tie to your medical record? I have no clue. So yeah. Anyway, and this kind of information, right? It's very important, like I said, to be in the system and to be secure. So yeah, uh, that's why it's very important that we have a centralized system. So health cloud offers that facility, and it also provide experience cloud, right? Experience cloud is something using which a user can log in and view information about their medical history, right? And also their tasks and goals, which they should be doing. Obviously, when you get a medical report from a doctor, doctor will prescribe a certain lifestyle change or certain medication so that you can focus on your health. So, sometimes patients would like to see those health plan. They can log into the health cloud using portal and see those information. So that's one of the advantage of the health cloud. Also, like in today's time, right after post COVID, most of the appointments can be scheduled through the phone, like in New Zealand, right? So what happens is that if you make an appointment for GP, usually if it's not very urgent, so GP will make you give you a phone appointment, right? So GP will call you and discuss, and you can discuss your problem with your GP or a doctor. I think I should be using doctor because, like I said, some countries they may not be using the term GP, right? A general practitioner. And then once your general practitioner is happy with that, then you don't really have to go and visit. And if your doctor says it's important that you make a personal visit, then he or she will book an appointment for you, and then you go and attend your to the your medical clinic, and where GP will see you and recommend further tests or whatever, right? So those kind of information, right, needs to be there. And so deliver care from everywhere, from anywhere. That's the important aspect. So healthcare do offer um, you know different functionality which facilitate that process. So let's look at some of the capabilities for providers, right? What is there in the health cloud? Because what I gave you is a generic view about a provider functionality, right? What a provider offers, right? So because it's very important to understand the context, right? Otherwise, you will say, "Hey, provider." Some people even confuse provider as an insurance company. No, it's not. That's the payer, right? Who pays for your service. So we're gonna look at that later stage. But for now, for today's episode, I just wanted to focus on the theoretical aspect of it. Okay, so what are the options provided by um, Health Cloud for provider? Provider relationship management, patient management, intelligent automation, patient acquisition, and outreach. Obviously, this is important for most of the centers because they wanted to retain the customers and also look for more customer through referrals and other options, right? Customers in the sense patients, right? Some patients have an issue, perhaps the clinic can offer them discount or other stuff, right? So yeah, so all this information can be uh, accessed using Health Cloud, depending upon the permission sets or permission groups that have in place. Because obviously, the information which doctors see will be very different to an information which receptionist sees. Because obviously, receptionists have no role to access a patient data. That's role being given to a doctor or a specialist who can access the person medical history. To based on that, they can look at it and formulate a plan so that they can help their patient. So um, Care coordination, we already looked at it, right, in the last episode where I've shown you how to add a care member and task and goals, right? So that's one part of it. And then we have a provider relationship management. So it's about, you can view information about the physicians, right? Their qualification, their experience. You can all view it from one place, right? So their onboarding, the interviews, and enrollment, everything can be done using patient relationship management. And Health Cloud offers that functionality. So as you can see, that Health Cloud system of record and engagement tools reduce further onboarding times and improve uh, provider satisfaction. So yeah, so that's very important, right? Then we have patient management. So allow providers to personalize how they deliver service to their patients. So it's personalized based patient management service. So intelligent automation, it's about scheduling an appointment kind of stuff. And acquisition I've already mentioned. Uh, it's like if they wanted to maintain the brand and effective marketing to target patient demographic, they can do that. So and using Health Cloud, you can do that, right? So for instance, if someone wants to, you know, um, say for instance, anybody over 50, if they need a breast screening right, for the breast cancer, they can target specific demographic, and yeah, so and the geographic area as well, and perhaps based on gender as well. Oh, yeah. So yeah, I mean, you can do such kind of things using Health Cloud. Health Cloud is very effective. Like I said, I use Health Cloud right for the project I work on, but our requirement is a bit different. So I can't really talk about it because, like I said, it's an NDA I've signed, so I can't really disclose any stuff. But just from a general perspective, all I can say that yeah, I work for Ministry of Health in New Zealand. I mean, I do stuff for them, right? You know, on the Salesforce side. So yeah, I do work on Health Cloud, and um, yeah, that's pretty much I wanted to cover in today's episode. I mean, I do understand, right? I mean, unlike other certification, right? Health Cloud, there's not much to talk about Health Cloud, right? Although there are functionalities which is very relevant, so which I'm going to discuss anyways. But compared to other clouds like Service Cloud or Sales Cloud, this Health Cloud is pretty limited. I mean, it's a tiny cloud, right? I mean, you don't really need to know a lot of things, but at the same time, if you're someone who is working in a health cloud industry and using Health Cloud, sorry, not in the health cloud industry, in the healthcare industry, and is using Health Cloud, then you need to know about payers, providers, care coordinators, and all other kind of stuff, right? So yeah, that being said, I hope you guys have an amazing Thursday. Adios.